confused right now.
Confused, and yet we still keep getting some of the same questions time and time again. So I thought we could maybe begin with a couple of very quick ones here to perhaps re-answer the questions that people have. One of it being about people who are asymptomatic but actually have the virus. Can they still spread the virus that leads to COVID-19 if they are asymptomatic?
Yeah, so the asymptomatic word, it depends, right? So in other words, if it's 0 symptoms, then they're probably not making virus copies yet. So the virus haven't started making photocopies. That's why they're not having symptoms. Now, in that situation, they don't have a whole lot of virus to give out to people. So the chance of having it pass is actually small, or you have to be in very close, intimate contact. However, I think what we thought of symptoms, meaning coughing. So a lot of people have said, there was nobody coughing in the room and I still got sick. So people can have symptoms of fever, body aches, that kind of stuff without coughing. Now they are making viruses within their body. So therefore, as they breathe in and out, there may be some virus particles there. And if you're very close next to them, sitting next to them, for example, or if you're hugging them, then you may pick up that as well. So that's why this social distancing is so important, because if we keep you 6 feet away, then that virus, I don't care how much you're breathing, is not going to get across to you. So therefore, the social distancing, even from people that are not coughing, might be a good strategy for us to take.
Mm-hmm. What if you just have a cold? Because, of course, here we are. It's not yet spring. People are still dealing with what is the normal cold and flu season. If they have no reason to believe that they've been in contact with anyone that has traveled or may actually have COVID-19, should they self-isolate even if they have cold-like symptoms?
Yeah, the answer is yes, because in the beginning, it's very hard to tell the difference between a cold or this COVID-19. And now that we have more cases, the concern is always, has the virus now gotten into the community? So in other words, you don't have to travel, you might bump into this particular virus. So we're always worried about that. So therefore, if you have any symptoms, you're not feeling well, then we want you to isolate yourself from the rest of the world in the sense of your work and school and things like that, but also from your family. So in other words, we always say self-isolation, but we forget that within the home, you may be able to spread that virus. So let's say you have a cold, you could pass the cold to others within the family as well. If you have COVID-19, you might be able to pass that as well. And when we looked at the data from China, 70% of the cases came from within the family. So in other words, if we can get rid of that spread within the family, then we can get rid of a lot of cases. As you're hearing, many of the cases are contacts of a person living in the home, for example.
Okay. Well, let's start bringing in some of our viewer questions. Jay McDonald took to Twitter, and this is what she wants to know from you. Can you please ask your doctor if we should still be traveling domestically? My work takes me right across Canada, and I'm scheduled to fly to Saskatoon next week. So should she still be flying to Saskatoon?
Yeah, most of the companies are now saying, let's just do it remotely by phone calls, by video chat, or whatever you want to do it, because that gets rid of the risk of being in very many public places, right? So being in an airport, sitting on an airplane, going to a hotel. So these are all public places where you're not sure who was there before. So in other words, to keep the travel down would be the best. And remember, this virus has to move by us. In other words, the virus has no wings and no feet. So therefore, it cannot move anywhere without our help. And so therefore, if you're bouncing from one province to another, you could then be the one that carries this virus, or you pick it up somewhere in the hotels or perhaps in the airports. So therefore, cutting that travel down would be very helpful in terms of decreasing the transmission of this virus from province to province.
Okay, so cutting down the travel, as you say. Dr. Lin, I am sorry to do this. I'm going to ask you to hold. We have so many more questions from our viewers, but we need to take a quick detour here to Nova Scotia, to Halifax, where we're getting an update now
COVID-19
on COVID-19 there. Let's take a listen.
Are with those individuals, and I want to wish them a speedy, thorough recovery. We've also taken additional measures based on this, and I'll have more to say about those later. But first of all, I'd like to have Dr. Strang talk to you about the 3 presumptive cases.
Thank you, Premier. Good afternoon, everybody. So we've had 3 cases in the last 24 hours reported from our lab, and we now have the capacity in the lab to be able to report presumptive cases tested here locally. They are all these positives are going to the national lab for confirmation. We have a 61-year-old woman who lives in Kings County who is traveling to Australia. A 50-year-old male who lives in HRM was traveling to the USA. And a 30-year a male in their 30s traveling extensively throughout Europe. So all of these cases have had travel outside of the country, which would have been their source of exposure. None of the 3 cases are connected to each other. Extensive public health follow-up on all of the cases and their close contacts began last night as soon as we were notified of the cases. We were able to say that there are a small number of Nova Scotians who were in close contact with these individuals, and all those, but we're fortunately a small number, all those individuals are now being asked to quarantine themselves for 14 days and monitor their symptoms carefully, and then call 811 if they develop symptoms suggestive of COVID. So the public health steps are well in place to manage these 3 cases.
Thank you, Dr. Strang. Minister Delory.
And thank you. And in light of this, I know Nova Scotians want to know not just the works and the steps that we're doing as government, but